Welcome to Dialogue. This week, and a new strain of coronavirus is causing severe challenges in the United Kingdom, while infections and deaths have skyrocketed in the U.S. Will the vaccine rollouts come to the rescue, and will that spell the end of the pandemic? To find out more, I'm happy to be joined by Dr. Jerome H. Kim, Director General of the International Vaccine Institute, and Professor Chen Hong from East China Normal University. Also joining today in the first half is Dr. Mohammed Munir, a virologist and lecturer in biomedicine, health and medicine at Lancaster University. And later on in the second half, I'll be joined by Eric Ding. He is an epidemiologist and senior fellow of the Federation of American Scientists. That's our topic. I'm Zhou Yue. So let me start with you, Dr. Munir. The UK Health Secretary Matt Hancock said Sunday that a new strain of coronavirus was, quote, out of control. And the British government has imposed a strict Christmas lockdown in London, and also many nations have halted their flights from the UK. Obviously, people are concerned, but what do we know about the new variant? Is the response appropriate?
Well, this new variant was first reported back in end of September in Kent region, and then it quickly moved on to the Greater London, southeast of England now. And now within London, around 62 out of 100 positive cases belonging to this new variant. So this means that this is now the most predominant strain within the southeast region. And this is really raising concern, particularly for two reasons. One is that it is transmitting more, around 70% more transmissibility compared to the regular strain. And then the second important aspect is that we are in the festive season, where the social contact would be really high, and if we allow this virus to penetrate into the society much more than it is currently having, this is going to overwhelm the healthcare system because the number of cases would increase, and therefore we know the hospitalization and unfortunate fatalities are associated with the number of infection. So therefore I think the restrictions, those being tightened up during this cheerful time, are appropriate and need to be done, because otherwise this is going to pose a very grim situation, which we already are.
And Mr. Kim, actually this variant is also identified in many other countries, and this new variant was actually not new. It was first identified in September. So why it has become a problem now?
So most new variants occur naturally and then begin to spread. And like the previous mutant that swept across Europe earlier this year in March and April, this new variant, with its increased transmissibility, is able to infect humans more readily. That, combined with, as the previous speaker said, with the festive holiday season and other human behaviors that are not discouraging spread, such as, we have to wear masks, we have to physically distance, we have to avoid crowds, and it's just been difficult to do that in the United States and much of Western Europe. So, the virus is very important. Human behaviors are also very important. And to the extent that we can control human behaviors, we do a much better job with controlling spread of the virus.
And we understand that both Pfizer and Moderna vaccines are to be rolled out very soon. Will the new variant make any difference about the effectiveness of the vaccines we know, Dr. Kim?
That's a very critical question. Our best guess right now is, without having actually done the tests, it's likely that this virus will be inactivated or neutralized by the vaccine-induced immune responses. But at this point, we still don't know. And I think a number of labs around the world are working to try to determine whether vaccine will continue to work against this virus. And our first guess is it should.
Dr. Munir, people are wondering why there is sudden a variant that is transmissibility increased by, some say, 70%. What made the virus evolve all of a sudden more quickly?
Yes, I think this is really important to highlight that out of those 23 mutations, those were reported, 17 were almost abrupt changes. changes that were acquired by this new variant in relatively short span of time. This is worrying. That means that there is some level of immunological pressure into the human population that is driving this virus relatively more mutant. But one thing I would like to highlight here is that, you know, when the virus first infected the human population back in January, December, at that point we didn't have any immunity against this virus. The human population was naive, so therefore virus has an open ground to play. But now 15 to 20% people are having one or other way of immunity. So therefore virus is finding a little hard to survive into the population. It will mutate, and it will mutate quite often. So these are likely events. We know that the viruses do mutate, but the mutation, if occur in a relatively shorter time and quite high number of mutation, that is really worrying, because that is making the virus even more transmissible. And over the time, this might be able to evolve in the situation where the accommodated mutation can make the vaccine ineffective in the long term.
So, Dr. Kim, considering that there are more people possibly infected with this new variant, should we change our plan to vaccinate? Because obviously there are two objectives. One is to reduce infection, the other is to reduce transmission. Should we change our plan about vaccinations?
So I think that we still have to realize that our best guess is that the vaccines do work and will continue to work. I think the other important point to remember is that COVID-19 mutates 8 to 10 times slower than influenza virus. So although these mutations are significant and reflect a new pattern of transmission, we're still not sure that, for instance, people are more susceptible to severe disease with this particular variant. In fact, we think that that might not be the case. But as with many things during the pandemic, we will find out. We still should continue to vaccinate. And I think the other thing to emphasize is we know that the vaccines prevent severe disease or symptomatic disease. We don't know that the vaccines prevent transmission.
Okay.
And so the prioritization, vaccinating healthcare workers, vaccinating the elderly, are really to prevent disease. We don't know, for instance, if we vaccinate children, if we'll prevent transmission, and they're not the initial target. The initial target is to protect the people who are most at risk from severe disease.
And another thing, Dr. Munir, is that COVID has made humans realize there are many things out of our control. This new variant is another reminder of this. So people are concerned and anxious. Do you think it is legitimate for people to worry about the development of this pandemic?
Well, certainly. I mean, this pandemic is going to revolutionize the biomedical research and going to transform the way we think about the pandemics. I mean, we have learned a few times about the small-scale pandemics, but those were unlearned very quickly. But now this intensity of the pressure onto the healthcare system and also onto the biomedical research, I think is going to really transform, and we will see a new way of vaccine development. We will see a new way of treatment development, and also preparedness probably would be much better. But onto the public domain, certainly there are things that need to have it done relatively differently. But the concerns of the public are also genuine. But what we are dealing with is that a pandemic that has things that we can't really control. I mean, what we can do is to act timely and prepare ourselves. But then there are things that we can't really act anything. For example, the new variant. I mean, of course, we as a human do contribute into how viruses evolve, because more the virus circulate into the human population, higher the chances for virus to get into the new variant and accommodate new mutations. But there are certain things that we can do, and then there are things we can't do.
And Professor Chen, let's come back to this country's situation. China has contained the virus without a vaccine, thanks to very restrictive policies in the early beginning. But people are talking whether China should have a large-scale rollout of vaccines. What is the deployment of vaccines program will be? What is your take?
Well, so far actually in China, since July, I think, there are already 1 million people who have received the vaccination, with very strict rules and regulations to administer the doses. I think actually so far, according to reports, the process has been going on very smoothly without very serious adverse effects reported. So actually there are also, the next phase of the administration of the doses. It is said that actually the next phase is going to start at the end of this year, that is right now, until probably by the end of February, that there will be 50 million more people who will be receiving their vaccination. So I think it is actually a step-by-step rollouts, instead of a kind of like instant rollouts, a national rollout. This is a step-by-step rollout. Firstly, to some critical groups, vulnerable groups, and also people at high risk occupations. On the other hand, of course, more people who are actually will be receiving the vaccination, and the general public will be receiving vaccination. Of course, that will be the next stage.
And a lot of people are waiting for the clinical results of the phase 3 trial of Sinovac vaccine that rolled out in Brazil. But according to some Brazilian regulators, they say that China using the criteria not transparently in the emergency approval. How would you respond to that, Professor Chen?
Yeah, actually there are a lot of, likewise, criticism in Brazil, especially, from the camps of anti-China ultra-rightist, groups. For example, like the President Bolsonaro, who is actually an ultra-rightist, person, politician. He is actually engaged in a kind of a personal political, conflict with his adversary, who is actually the governor of the state of São Paulo, and that is the Mr. Doria. And Mr. Doria, incidentally, is actually supportive of Chinese vaccines. So there's a lot of personal, conflicts, and also personal, vendettas that is actually at play. So actually there are some kind of, efforts, in Brazil trying to discredit, the Chinese vaccines. But in fact, of course, China always attaches greatest importance to safety and efficacy to the vaccines developed in China.
So I presume that you don't agree politics should be in the way of vaccination trial.
Yeah. I think we should not be politicizing, vaccination and also science and medicine. Instead, actually, people's safety and also the efficacy of the vaccination, that will be actually at the priority of the agenda.
And Dr. Kim, how do you look at China's vaccination programs down the road? Because, as I said earlier, there are very few cases, most of them imported. Should China vaccinate its general populace, even with very few cases?
Yes, I think that the one thing that we have to recognize is that every country has a different set of priorities. In the West, in the United States, emergency use authorizations are given in the presence of efficacy and safety data, and China chose to allow emergency use before efficacy data were announced. Now, the Chinese people and Chinese government have a responsibility to protect their people, and I think that one thing that COVID has taught us is that if we're not ready, we can be surprised, and very unpleasantly surprised, as we see with the resurgent pandemics in Korea, in Western Europe, and in North and South America. So, for the Chinese government to make a very reasoned assessment of what its actual needs are and its priorities, I think are going to be very important. And so, we have to lead with the science, as Professor Chen said. There should be no politics involved. We should look at the safety and efficacy of these vaccines, at who can make a high-quality vaccine. And, we do really need to provide this vaccine to countries all over the world, not only China, not only the United States, not only Europe. It's a part of being a good global citizen. The idea that the United Nations has said that, no one is safe until everyone is safe. So we really do have to remember that if the high-income countries, that is the countries with the biggest economies, take the first 2 billion doses of vaccine without any consideration for equity for the rest of the world, global COVID deaths will double. And that should be considered an unacceptable circumstance.
And Dr. Muni, I want your take on this, because if the efficacy data is out and the Chinese regulators approve the vaccine produced by the Chinese, many Chinese are still asking, is it really necessary to be vaccinated when we have contained the virus within the national border?
Yes, I mean, this is something very important, not only for the Chinese perspective, but more onto the global perspective, that if the disease is prevalent and is endemic in many countries, particularly in the neighboring countries or the highly trading countries, then the threat would still be there. So as the virus moved from one location to another location very quickly, the chances that it will revert back very quickly as well. So therefore, I think at least until the disease is under full control or until we have 75% population in the world immunized through different vaccine approaches, the risk would still be there. And if there is a provision for the vaccine and the availability of the vaccine, I think it would still be advantageous for the Chinese population.
And Professor Chen, of course, people are asking, is the vaccine testing approval process in China working differently than elsewhere in the world, where we are now?
Yes, I think actually there is something identical between the regime in, the system, in China and also elsewhere. That is actually the three phases of the testing, of the trials. That is actually very identical. But on the other hand, of course, the Chinese central government is also exercising a lot of stringent, control upon the assurance of the safety, quality, and also finally, of course, the equal distribution of the vaccine. So I think actually that will be, very important. There are no, international standards to standardize, the process. There are, the United States FDA, system. There are also CDC system, also the WHO requirements and regulations. Of course, in China we have got the Chinese Center for Disease Control and also Prevention. So we have got the utmost authoritarian, regimes that is actually at play to ensure the quality and also efficacy of the vaccination. One additional note about the differences between the application of the vaccine in China and also elsewhere is that, as the previous discussants have been discussing, that in the West this is indeed the festive seasons, but in China the Spring Festival is in more than one month away. So definitely this is very desperate in the West. But actually, in China, it is still, the transportation and also the festive season is still, one month away. So that is actually quite a big difference.
And Dr. Kim, let's look at the vaccines already approved and available. The Pfizer vaccine and the Moderna vaccines, they're 95% effective in the phase 3 trials. How would you assess the rollout of the program of the rollout?
So in the countries that have now issued emergency use approvals for the vaccine, rollout is proceeding very rapidly. There are some concerns around allergic reactions, severe allergic reactions to the Pfizer vaccine. The Moderna vaccine is still in the process of being shipped, and I would guess use will start this week. We would expect that all vaccines have adverse events, adverse effects. Some people have allergic reactions. I think that the regulatory agencies like the FDA in the United States and the EMA and the MHRA are taking the reports very seriously and are recording them, and are trying to understand if there's a component in the Pfizer vaccine that is responsible. And this is what you want regulatory agencies to do. And so I guess we will learn more as time goes on about the nature of these severe allergic reactions. But in the meantime, healthcare workers and the elderly are being vaccinated. So hopefully that will increase the level of confidence that we have in the vaccines and in their ability to protect populations against disease.
All right, we're now joined by Eric Dean from the Federation of American Scientists. Eric, probably the vaccination will take some time to see the effect in the U.S., but when can we say that the vaccination already is working, is helping Americans fight this epidemic?
Sure. The vaccines are being rolled out very quickly. In 1 week, they've vaccinated almost 250,000 people. And I think we're very close to 500,000 people in the coming days vaccinated. The vaccine takes about 1 week, about 10 days to take effect, to start giving you protection. But you need a second dose for the full 95% efficacy seen in these two vaccines. So, which comes at either week 3 or week 4 of the two vaccines. So I think for the full protection, it's going to be at least a month. But in terms of the rollout, anyone protected or taken it obviously gets protection very quickly after 10 days. But for any larger protection, you need huge numbers of people vaccinated. And right now, the U.S. is still trying to get through our healthcare workers and then essential workers. So the general population will not see the vaccine until late spring and early summer at the earliest.
So it's probably required or something that really should people be considering when they're taking their holidays to keep social distancing and wearing masks, you are saying. Because we have seen increasing numbers of death and infections in the U.S., 249,000 in 1 day infections. Is that something we should keep in mind?
Yeah, we definitely cannot let down our guard because the infections will keep going for a very long time. And, you know, people talk about herd immunity. The only type of herd immunity that is scientifically public health endorsed is vaccine-based herd immunity. And you need at least 3/4 of the population, if not 80%, to be vaccinated. And that is way, way down the road, probably in the fall or maybe next winter before we reach that.
Yeah.
And that's why right now we still have to focus on mask ventilation, because this virus, according to the CDC, is not really surface contact anymore. It's really airborne transmission. And ventilation, air cleaning, germicidal UV, all these things that keep the infection rate low is what is really needed now until the vaccine is ready.
And Dr. Kim, obviously Europe and America are among the first beneficiaries of the vaccination program, but there are still a lot of countries, probably poor countries, who cannot get access to that vaccines. What is the mechanism that can make a difference about equity?
That's a great question. And I think China actually started vaccinating first. China's vaccinated over 1 million people and plans to vaccinate 50 million. I think equity is very important. And, you know, President Xi did commit to vaccines as a global public good as he was talking about something called COVAX, which is something led by the World Health Organization, Gavi and CEPI, and which intends to have 2 billion doses of a World Health Organization pre-qualified, that is the international standard for quality, WHO pre-qualified vaccine by the end of 2021. This should provide 20% of anticipated need for the 189 countries that have signed up for COVAX. So this is a critical step. We have never in the past had a vaccine that is rolled out in the United States and rolled out nearly simultaneously around in low and middle income countries around the world. This is an important first step. COVAX is so the World Health Organization and Gavi and CEPI are working very hard to ensure that those doses are available and are available at low or no cost to 92 countries around the world. Very important.
Professor Chen, Dr. Kim just mentioned China already vaccinated millions, but that's for emergency use because Chinese vaccine has not passed the approval of the regulators. But when that happened, will China put on the priority list to provide some vaccines for developing nations?
Yes, definitely. As Dr. Kim just mentioned, during the WHO assembly in May, President Xi Jinping actually pledged that China will be making the Chinese-made vaccine to be a global public good. That is a very solemn pledge, and that has been put into practice because in a number of countries there are altogether 5 Chinese vaccines that is being on phase 3 trials in 16 countries. So altogether we can see that actually there is earnest efforts by China to support, especially those developing countries to have the vaccination, which is of utmost importance, especially with the variants, with the mutation of the virus. We see, especially in some developing countries where congestion and also their shelter is quite cramped. In such cases, really the spread or the transmission of the virus can be very, very desperate. So in such cases, China will be definitely supportive of developing countries, as one of the discussants just mentioned. If one country is actually vulnerable, all the globe is vulnerable.
But Dr. Ding, still many options on the table. Pfizer vaccine and Moderna is an mRNA vaccine, and China and Russia have been developed their own homegrown versions. Sinovac and Sinopharm uses inactivated forms. Russia vaccine is adenoviral-based. What are the differences of those approaches if we see similar effectiveness?
Yeah, and that's a really good question. The mRNA obviously requires freezing, and they're a relatively newer technology, although some argue a cleaner technology because it disappears very quickly. The Russia one is an adenovirus, just like the Oxford one, which uses a Chadex1 adenovirus. It basically is spike protein hitches a ride on another very harmless virus. While the mRNA, you feed it the blueprint, the RNA blueprint to make the spike protein of the virus itself, but not the actual virus. But the Chinese ones are the older inactivated vaccine, the traditional vaccines, you could say, and they're basically dead versions of the coronavirus vaccine. And so they all have different approaches, and the Chinese Sinopharm, Sinovac, they've been tested a lot more. And there's another type, Norovax, that is directly the protein itself. In certain ways, they all have their pros and cons. The Oxford one is much cheaper, 8 to 10 times cheaper, and it does not need freezing, but it needs 2 doses. But the Johnson & Johnson one is a single dose. I think Sinopharm is also a single dose, I believe. And Johnson & Johnson does not need any freezing whatsoever. So in terms of developing countries that do not have ultra-cold freezers for the Pfizer vaccine and do not have reliable freezers for the Moderna vaccine, some of these other options might be a better choice, especially being 10 times cheaper and easier to transport.
If they are safe and effective, at least we have different options that we can choose from. And Dr. Kim, it seems that in 2021, the world will be equipped with a lot of vaccine options. Is light at the end of the tunnel in sight?
I think the best way to think about this is that this may be the end of the beginning. Now that we have a weapon to fight against COVID, we have to combine that with a continued strategy of comprehensive prevention that includes masks and distancing, better ventilation, avoiding crowds. We also need then to put that vaccine into the hands of people who are going to be administering it into 8 billion arms around the world. And that is a huge task. When we think about how successful childhood vaccinations have been, where we vaccinate just the children around the world, 80% of children get their vaccines around the world, and that's really important. But now we're going to have to vaccinate their brothers and sisters, their parents, their grandparents. And that is something that we haven't really done before. And it's going to be a huge task, and I think it's going to require everyone in a multilateral global solution.
I have to leave it there.
Problem.
Thank you very much, Dr. Kim. Thank you, Dr. Ding. Thank you, Professor Chen. You've been watching Dialogue here on CGTN. I'm Joanne Beijing. Thanks for watching. Goodbye.